This is one of the poorest neighborhoods in Manaus, a small favela built illegally on a hillside. Public utilities are scarce, and there's no regular waste collection. But the neighborhood can be proud of its communal nurses and healthcare system. Women like Maria Fatima and her colleagues, who every day walk around the streets of the favela to help out people. Today, she's visiting son José, 73 years old. The old man has diabetes and now stays in his home all the time.
I'm going to prick the tip of your finger, okay? Just for the test. We must meet the people. This man cannot walk anymore, so we come to him, to his home.
This local healthcare system was inspired by the Cuban example. One of the objectives is to relieve hospitals by emphasizing community-level prevention and care, a precious help in this poor neighborhood.
We don't have much money. My husband is the only one who has a retirement pension. We're dependent on these medical visits. How can I say the opposite?
Further down the street, we meet with Maria Santana, 30 years old, 10 pregnancies. In her arms, little Karine, her newborn daughter. Contraception, sexually transmitted disease, breastfeeding. With every visit, the nurse gives out precious information.
Put your hand like that under your breast. Don't pinch it like that. And then bring it close to her mouth.
Like every other Tuesday, it's Children's Day at the small communal health center. Just for the city of Manaus, there are 160 free clinics all over the city.
Who's next for the consultation? You, sir? Okay, please come in.
Samuel da Silva is unemployed. He's brought his children here for a routine checkup. The man in charge of this health center is Dr. Enio Candidoa, a man who firmly believes in the virtues of this preventive medicine close to the people. Our most important objective is to educate people, especially simple things. Regularly wash your hands, how to fight against malaria. In the end, this will lower healthcare costs. Without education and prevention, we just won't make it. Before, the hospital was the only place one could go for a treatment, or even for a simple checkup. Now, for Samuel's children, it's free and close to their home.
Before, there were no health centres. Now it helps us a lot. For the people without money and for the children. It's a solution for people who can't afford to buy medication.
A prescription, a signature, and that's about it. Elizabeth is happy. She'll go back home with medicine and vitamins for her 2 daughters. Meanwhile, home visits continue for Maria Fatima, every day strengthening the local community ties. In a city where the average fecundity rate is 3.8 children per woman, her work and her help is both precious and appreciated.